2 weeks into the alert level system. How has that impacted the private sector, especially for you guys over at the export industry?
Well, if you look at the new system, no, the GCQ alert level system, it is the level 4 is practically pretty close to ECQ. Okay, although having said that, the essentials and the export sectors were not really too much affected. But the other issues such as mobility, of course, it's affected, and we would look forward to more relaxation in opening up the economy.
Okay, so would do I take it to mean, sir, that you are at least in agreement that restrictions, especially in Metro Manila, should be eased further to alert level 3?
That's right. Um, there has been talk about lowering down the alert level, and which we agree. But at the same time, we support the granularity approach of the government. And lately, as you mentioned earlier, President Duterte has authorized the vaccine czar, Secretary Charlie Galvez, no, to start vaccinating the other sectors of our society. Because in the earlier stage, we were just giving priority to the elderly and to the A4. But we need to vaccinate more, provided the vaccines are available. Just to share some thoughts that I was able to get from Singapore's approach towards in dealing with the COVID-19. They have realized that the vaccination, although continuing, would not mitigate really the spread. As a matter of fact, they have experienced increased infection lately. So they're now talking about really getting the citizens to be involved in testing themselves so that the hospital care, healthcare would not be overwhelmed. We know very well that 95% of those uh, checked and found out to be positive are either asymptomatic or mild symptoms. And this is where I think the government should take action to allow the private sector, especially the marginalized. The government should provide free saliva or antigen test, wherein an adult can test the old and young in their family, and those who are cleared in coordination with their LGU must be allowed to travel. Because one of the issue now we have is the mobility, the transportation, the public transportation is still quite a grayish area, and people cannot if you cannot go to if you cannot commute, you cannot work, and you're talking about a good at least a good 40% of our working population cannot commute. So that's my take on this on how we can in a way gradually open up, but we still follow the science. But if the testing by the community would help, that would gradually give us confidence in opening up.